I'm a second-generation urologist. I grew up in Louisiana and attended LSU undergraduate, and after 3 years I was fortunate enough to get into medical school, and I finished at LSU. At that point in time there was a thing called the draft, and so I negotiated and was able to do my internship at Letterman Army Medical Center in San Francisco. I then did my residency at Fort Sam Houston, Texas at Brooke Army Medical Center. I then stayed in the Army as preceptor for urology at Fort Hood, and after leaving the Army, I came to Birmingham. I've been primarily at Brookwood Hospital for over 30 years and have enjoyed my practice. I went into urology, I guess, after exposure to my father. Urology is a nice specialty. It has both medicine and surgery. It's thought of as being a surgical specialty, and it is. There's a lot of surgery. As urologists, we go into the abdomen, we go into the retroperitoneum, into the retropubic space, and occasionally into the chest. We also do genital surgery. So there's a wide variety of surgical procedures we do. In terms of medicine, we manage a lot of chronic diseases such as chronic infection, neurogenic bladder. We work with male infertility, some sexually transmitted diseases, do medical management of prostate cancer and bladder cancer. So there's a wide variety of choices in urology and expertise in urology. The other nice thing about urology is we get to follow our patients for a long period of time. I have some patients that I've been fortunate enough to be involved with for over 30 years. I have one family that I'm treating the fourth generation of the family, which is kind of a delight. So it's been very enjoyable to be in practice over this period of time. I think I've been fortunate to develop some talent in prostate surgery, endoscopic prostate surgery, transurethral surgery of the prostate, the bladder, and ureteroscopic surgery with stones up to the kidney. Those would probably be, if I was to pick one area, that would probably be my choice. But I like doing a little bit of everything. One of the outside interests I've had over the last 30 years has been doing some research projects. I've been fortunate enough to be involved in many drug trials. Was one of the original investigators for Viagra, which made me very popular with a lot of my patients. I also have done some device studies in terms of incontinence procedures, and that has been an interesting aspect that nobody told me about in medical school. I'm retired from the Army. I got to do a recycle at Desert Storm, so I've had a wide experience both in Birmingham, in the military, and have enjoyed my medical practice for 30 years and look forward to caring for my patients for a bit longer. I am married to a high school classmate. I have 3 children, a lawyer, a nurse, and the director of public theater in Kentucky. I have a lot of interest outside the hospital. I do a lot of hunting, fishing. I do a lot of woodworking with furniture building. I train some of my hunting dogs, and I like to travel. So I have enough interest to keep me occupied on the weekend.